in terms of where the journey might take you, if we find obstructive sleep apnea, then the treatment will depend on the severity of the condition. Sometimes if it's very mild, we actually don't need to do any treatment, and it's simply enough to reassure the patient and their partner that sleep apnea is mild. But if it is more severe, then there are a number of other options in play. The first thing, of course, is conservative management, and where the patient is overweight, we would advise them to lose weight. However, very often I find that, of course, the patient is aware of that already and has not been successful in doing so. The second line of treatment for milder cases of obstructive sleep apnea might include positional therapy. We'd find that some patients are much worse when they sleep on their back than on their side, and that's data that comes out of the sleep study. And where that is the case, there are a number of mechanical approaches that can be used to avoid sleeping on your back. And again, for some patients, that's sufficient to solve the problem. A second approach for people with milder disease is to use a dental device. Now, this is a little bit like a gum guard that a sportsman might wear, or if you have children, you might find your children are wearing it to play hockey or something like that. But essentially, whereas a sportsman has the gum guard in a neutral position, what you want for sleep apnea is to push the lower jaw forward like this. And these devices anchor onto the top jaw and push the lower jaw forward in that way. So you do, of course, have to have healthy teeth to do that. But again, that's a good solution for many patients, and of course is very portable. The gold standard treatment for obstructive sleep apnea, though, is what we call CPAP. CPAP stands for continuous positive airway pressure. And if you remember, we realised that the problem is about airway closure here. And what CPAP is a mask that's worn typically over the nose, or sometimes the nose and mouth. And the mask is connected by a pipe, a 2-metre pipe, to a unit that sits on the bedside table. And the unit on the bedside table is actually simply a blower. People often think it contains oxygen, but it doesn't. It just blows air from the room down the pipe and through the mask, and the air pressure holds the airway open from the inside, so it's a kind of pneumatic splint, if you like.